In this time of pandemic, vaccines, and lockdowns, many are fearful and worried about health and welfare for themselves and their loved ones. There are many questions such as vaccines, vaccine efficacy, vaccine side effects, COVID variants, lethality, odds of getting infected, and even possibility of death. What can I do to protect my family and loved ones? Does the Bible and health science provide any answers for what we can do to strengthen our health and our immune system? 3 John chapter 1 verse 2. Beloved, I wish above all things that thou mayest prosper and be in health, even as thy soul prospers. Of course, we know we have been told to wash our hands, wear masks, social distance, and get vaccinated. But how about improving our health and strengthening our immune system? Will improving health help us survive and avoid severe sickness? Let's look at the Bible first. We know from the above verse that God wants us to be in good health. As long as Israel stayed with God, there were no sick ones among them. In Psalms 91, 5, 6, and 7, thou shalt not be afraid for the terror by night, nor for the arrow that flieth by day, nor for the pestilence that walketh in darkness, nor for the destruction that wasteth at noonday. 1,000 shall fall at thy side, 10,000 at thy right hand, but it shall not come nigh thee. Again, in Luke 4:40, Jesus healed. Now when the sun was setting, all they that had any sick with divers diseases brought them unto him, and he laid his hands on every one of them and healed them. We also know from the spirit of prophecy that God has given us the 8 natural laws of health: nutrition, exercise, water, sunshine, temperance, air, rest, and trust in God. These are 8 natural laws of health that if we live according to them, we will have better health, live longer, and have less disease, and possibly our immune system will be stronger to fight off diseases so that we don't get severely sick. Now, let us look at some modern science. Let us look at a research report from America. This is about underlying medical conditions and severe illness among 540,000 adults hospitalized with COVID-19 in America from March 20th last year till March 2021. 1 year. This is about severe COVID-19 illness in adults has been linked to underlying medical conditions or diseases. This study identified frequent underlying conditions and their attributable risk of severe COVID-19 illness. So it means to say that other diseases plus having COVID-19 is what actually got them hospitalized and some of them died from. So it's linked together. So if we can avoid those diseases, is it possible that we will not be hospitalized or not get severe illness or die? Will it help? This is what this article, this deep research report may indicate. Let's continue. Their methods. It says we use data from more than 800 U.S. hospitals in the premier healthcare database special COVID-19 release to describe hospitalized patients aged 18 years or older with COVID-19 from March 2020 through March 2021. We used multivariable, generalized linear models to estimate adjusted risk of intensive care unit admission, invasive mechanical ventilation, the ventilator, and death associated with frequent conditions and total number of conditions. So they gathered all this data from over 500,000 people who had been in 800 hospitals in America over this last year due to COVID-19 infection. This is a very big study, so it should be reliable. It should give us good ideas. Now the results. Among all of these hospitalized, 94.9% had at least one underlying medical condition. At least one underlying medical condition. So that's approximately 95%. Sorry, they're mowing the lawn outside if you can hear it. Some of those underlying medical conditions or diseases were essential hypertension. I believe that's high blood pressure, if I'm not mistaken. I'm not a doctor, but disorders of lipid metabolism, or inability to deal with the fat in the diet, difficulty. Obesity, 33%, was the most common. The strongest risk factors for death were obesity. Second, anxiety and fear-related disorders. Third, diabetes with complications, as well as the total number of conditions. Now, some people didn't have just one underlying disease besides COVID. They had 2, 3, up to 10 underlying diseases. And the more underlying diseases that people had, the more severe was their situation, their hospitalization, and their risk of death, of course. So the more underlying diseases and the severity of those diseases affected their outcome, whether they got severely sick or they died. Do you see the link? Do you see the connection between good health and not getting severely sick and, of course, not dying? The conclusion. Certain underlying conditions and the number of conditions were associated with severe COVID-19 illness. Hypertension and disorders of lipid metabolism were the most frequent, whereas obesity, diabetes with complication, and anxiety disorders were the strongest risk factors for severe COVID-19 illness. Careful evaluation and management of underlying conditions among patients with COVID-19 can help with their risk for severe illness. In other words, in common, simple English, if we manage, if we take care of, if we reverse, reduce those diseases, high blood pressure, obesity, diabetes, and high stress levels in the life and anxiety disorders, then our chances of not getting severe illness and not getting sick are much, much, much less. You heard the figure. It was nearly 95% of those hospitalized and those who also of those who died had underlying diseases, other diseases which complicated and made worse their COVID symptoms. So what's the good news of this? What's the good news? That's some difficult things to think about, but what are we looking at? What's the good news here? Let's summarize. The Bible is full of verses about God protecting us from pestilence, Jesus healing us from all kinds of diseases, and giving strength and good health if we follow his commandments, his instructions, and his counsels. On the other hand, if we will not follow God's commandments, instruction, and counsel, we may reap ill health, disease, sickness, and even death. The recent report from America on who the COVID-19 most severely affects shows again that if we are obese, have diabetes, heart disease, and are overly stressed, we are more susceptible to severe disease or even death from COVID-19 and its variants. The good news is that most of these diseases, comorbidities, are reversible by following God's 8 natural health laws. God says choose life and follow him and his instruction. It is encouraging that if we will follow God and practical sound health laws and modern sanitation methods, our health and immune system will be optimized and we have a great opportunity to survive and thrive even during a pandemic. Let's choose life and health. Let's choose to do those things that will make us strong. You may see the report. I have connection to it here. You may follow it. It's quite technical, but it's very good for pointing out the link between underlying diseases and COVID-19 and the severity of the disease. And so that gives us a lot of hope that we may reduce severity and death by improving our health. Thank you, and have a good Sabbath. We'll see you.